Those who don't know me, my name is Sally Young. I've been practicing for about 20 years. I finished my residency over at Hopkins and came to U of M, worked there for 4 years. Then went up to Genesis as a group practice for 4 years, and then past 10 years I've spent in my own solo practice, and then now working part-time here at Chelsea since some time ago. So I got interested in concussion more because initially, while I was training, I was doing a lot of head injuries, but more the severe type, the very severe TBIs, as well as spinal cord injury type patients. As I did more outpatient work, I became more interested in concussion. And on top of that, I have two boys. So they're 14 and 10 years old. So there seems to be a lot of more physicality with them. Plus the fact my husband's also from 3 boys, so he thinks this is normal. I find it slightly abnormal, but anyways, so that's the reason why I got involved. So the talk is more geared towards sports-oriented type, and again, it's because of my boys that I'm involved in more of the concussions. My boys are involved both in lacrosse and baseball, things with balls and sticks, basically. It's really lacrosse is why I got involved. And as a sport, they seem to be more involved in trying to prevent the head injuries. Because it's newer here in the Midwest, my husband's from the East Coast, so it was a common sport to play out there. So I like the fact that they're doing this. They're trying to do more preventive type stuff. And basically, because that's our only brain. It's ours for 80, 90, however many years we're going to live with it. And so we want to keep it as agile as possible. So what I'm going to start with is, we're going to start with definitions, then the pathophysiology, some symptoms, diagnosis, treatment, long-term effects, and possible prevention. So the definition of a concussion is a transient neurologic impairment resulting from an impact to the head or body with no detectable structural injury on standard neuroimaging studies. It's difficult to diagnose, unfortunately. Mostly it's by symptoms. We don't see, CT scan doesn't show us anything, the MRI scan doesn't show us anything. So it's also very difficult sometimes to talk to coaches and parents that their kid does have a concussion for whatever reason, and they need to stop their play and even stop school. And that's a very hard, especially in this day and age where the kids are doing more travel, be it hockey, lacrosse, football, whatever game that they're playing, trying to pull them out of their sport is a difficult thing. But it's important. It's one of the things I really want to stress with this talk is we have to be pretty proactive for the kids. Because again, that's their only brain. That's all they're going to have. The stats, these are a little bit old, but some of this come from the CDC. At the end of the handout, I have bibliography. The CDC has an awesome pamphlet on concussion. It's simple to read, it's easy. There are also some simple things that you can do just at also the sidelines when it comes to kids and concussion. So there's 1.6 to 3.8 million sports, recreation, mild TBIs that occur every year. Most of them aren't seen in the hospital or emergency room. The leading causes in the emergency room that's seen are falls, motor vehicle accidents, unintentionally struck by or against an object. That happens in our house quite frequently. So it's more, I think, a boy game thing. Also, there's assaults and sports come next. Okay. The ages at the highest risk are from 0 to 24 years of age, with middle school peaking as well as up to young adulthood. And then it peaks again at 75, and those are mostly our falls here and motor vehicle accidents. And the pathophysiology of concussions occur because of dysfunction of brain metabolism rather than just structural injury or damage. So that's why we don't see this on CT scan or MRI. And what happens, or what the theory is, and what they've seen in animal studies, is the trauma occurs, the neuronal cells kind of stretch, they expand, and then what happens is the cells release potassium and glutamate, and then calcium flows into those cells. And that causes a mitochondrial dysfunction. And because of that, it takes time for this to all heal. So this, they believe, occurs within the first 7 to 10 days of the concussion. On top of that, there's also decreased cerebral blood flow. Not enough that we see it on CT scan or MRI scan, but enough that we can measure it in the animal studies. So that is, again, part of the problem. It's all micro type of stuff. Nothing that we can measure at all. We can't measure, the calcium flowing into the cells by blood work. We can't see the decrease in blood flow by CT scans. Even the PET scans, we're not really able to see that. So it's hard for us to diagnose by those type of testing, and that's part of the issue, again, to diagnosing concussions and making sure that everybody understands that they have a concussion. In the animal studies, what they're saying is that it takes 7 to 10 days for this to heal, or hopefully return if it's just a mild concussion, with no other severities or traumas that are occurring with this. And humans, they're saying it could take up to 4 weeks. So all of this, yeah. So the whole treatment of taking them out of the game when this occurs or when the concussions occurs is really important because they need that healing. They have a second concussion within the 7 to 10 days. Their feeling is it delays the healing even longer than what was originally understood. So that's why it's really important and to kind of stand your ground that this child, we believe, has a concussion out of the game. And I know that's, again, hard. I'm one of these parents out on the sidelines also. But again, you need to think, what's the risk? If the kid misses the game or misses a couple games, there's no risk to that side. If the kid goes back in the game and something happens this time, you could seriously have either a bleed or a serious head injury at that point in time. So that's usually what I argue back with parents and coaches with that. If I'm wrong, nothing happens. If you're wrong, I don't know. So, that usually stops them for at least a game or two on that part. And also part of the problem is if we restart them too early, going back to school or going back to work or going back to their sports, we can develop some of these later problems, which I'll go into, which is the post-concussive syndrome. And that's what we want to try to prevent in these patients also. So not only do we want them to turn back to everything that they're doing, but we don't want them to have symptoms later on. And the symptoms usually fall into 4 categories. There's physical, cognitive, emotional, and sleep. The physical symptoms usually are headaches, nausea and vomiting, balance problems, dizziness, visual problems, fatigue, sensitivity to noise and or light, numbness and tingling, dazed or stunned. Cognitive ones are feeling mentally foggy, feeling slowed down, difficulty concentrating, difficulty remembering, forgetful of recent information or conversation, confused about recent events, answers questions slowly, or repeats questions. And then emotional are irritability, sadness, lability, nervousness. And then sleep, they're drowsy during the day, they're up at night, they sleep less than usual, or they sleep more than usual. They have trouble falling asleep. So these are all the symptoms that we're looking for after what we believe the patient has a concussion. So the diagnosis that we usually use to help us with concussions are standardized assessment of concussions, a balance test, acute concussions evaluation, imaging, and neuropsychological testing. The standardized assessment of concussions, I think you guys should have a copy of that. It's a really simple and easy test to do. Ideally, all kids who are in sports, you hope they would do just a baseline of this test. It only takes maybe 5 minutes to do, and they should receive 30 out of 30. Okay? But if at least you have a baseline, and then something happens on the sideline, you can easily do this test in 5 minutes. And if there's any changes, if there's a drop in point in their scores, then they have a concussion and they need to come out of the game.
1 point drop?
Mm-hmm.
What if the baseline isn't 30?
I know, I was trying to look up on that. The baseline should be, when you look at this, it's not that difficult, but if their baseline is not 30, it's just a drop in whatever their baseline was. So that's why ideally,
Yeah.
you want it done before they have the concussion. So, yeah. Like I said, and I talked about this earlier in the morning, that most of these teams aren't doing this. My husband is coaching 30 kids. He's like, yeah, good luck to you if you're going to do this for the team. But trying to do this test on 30 kids is going to take a lot of time and energy to do that. It does, though, make it so much simpler if something does happen on the field. And again, it has happened when I've been there. And so trying to convince, not my husband per se, because then he'd hear it all day long at home, but trying to convince another coach or the parent that this is not, I mean, I've had a child, actually my husband was there, I was not there, and he came back to tell me this, that something happened at school, and it was a 5th grader, and he complained to his dad that he had headaches, and they cleared him, so he went to do lacrosse practice, and my husband, didn't know what was going on, and then the kid's like, I really have a headache, and the parents said, oh, he's fine, and they found out that he had, so he came back and asked me, well, what should I have done? I'm like, you should have yanked him out, and it doesn't matter what the parents say. So he goes, well, but the head coach said, and I'm like, it still doesn't matter, you're liable, the adult is liable on the field. Don't care if you're the head coach, the assistant coach, the referee, you're all liable on the field of pushing. As a friend who's a lawyer, he says, just run the other way then. So that's the problem, is that you don't want this child to be hurt later on. So if they have headaches, if they have any of those symptoms that I just talked about, they should not be playing. Also, if you think the child has a concussion on the field and their sex ends up to be completely normal, then you exert them, meaning, make them do 5 jumping jacks or 5 push-ups and physically exert them and then do the test again. If the score drops, then you know that he has a concussion and it will flare up when they're doing the activities. Okay. So that's to just double check. The other quick kind of test is balance seems to be always involved in the concussion. So a quick test is, most people can stand on one leg and they're fine. If you take their eyesight away, they all of a sudden lose that ability to do that. So that again tells you there's a possibility there's a concussion off the field when they do that. Okay. Then there's a more extensive evaluation, which tends to be more the physicians doing this. This is the acute concussion evaluation, and it should be in your handout sheet. This is, again, with the CDC's heads up pamphlet. It's a quick, easy thing to do in the exam room. It's also something you can do serially so you can see if there's improvement, and that's what you kind of want to see. As time goes on, that their scores get higher. And then, as I stated, imaging, it's more to rule out the serious injuries. So, the subdural hematomas, subarachnoid hematoma, skull fractures, bleeds that you see, you just don't want them going back in. So, if there's any possibility, they go to the emergency room to get the scans done. So, the CT scan is the quickest, most sensitive for any bleeds. MRI scans. What we've found is later on, those who do have concussions seem to have some decreased prefrontal cortex, which is consistent with some patients who have chronic depression. So that's something to also be aware of later on, and that also goes with the post-concussive symptoms later on. The actually ideal is the neuropsych testing. Unfortunately, it's the wrong test, and most kids don't want to do that test. They don't want to, as soon as you say test, they don't want to do the test. Ideally, if we could get these testing on all these kids, that actually would be the gold standard baseline. So it'd be nice if we could get all our athletes to do this. And one of the other therapists had said that her son's hockey team does that, which is awesome. I'm not sure how they convinced to do it, but that's part of their program. And that would be great if we could do that for every single travel team as well as high school team and college team, but they don't do that. There's two different type of neuropsych testing that I was seeing for the head injury was the computer versus the human type testing. Computer's quick, easy. The problem is that you miss some of the auditory processing type as well as memory and then the neurobehavioral type things that the computer's not going to be able to tell you. So if you could do a combination of both, again, ideal. If we could do it for everybody before they started their sports, also ideal. Then you could just do serials. The problem with that is the amount of time, the amount of money. Also with younger kids, we're going to have to, you have to do that every year or two because of their developmental changes that are coming. So it's extensive and expensive, but it would be nice. And so that's a copy of the standardized assessment. And then the treatment for a concussion, especially if you see somebody right after a play, is no activity on that day. Then no physical or cognitive activity until all the symptoms resolve. So that actually includes school. And I know how hard that is, being a parent myself. I'm probably a crazy tiger mom, but they really find that even if they do simple things like texting or on their tablet playing games nowadays, that's enough of a stimulation of their brain that it's enough to slow down the healing process. So, good luck to trying to keep them off of those items while they're at home. But
yeah, but does reading do the same thing? I mean, what
reading
can
does
they
the
do?
same thing. That's the problem. It has got to be a cognitive as well as a physical break. I know. And that's what they're saying is reading, watching TV is a stimulation of the cell. So that part I don't have a good answer for, and it's hard to do for two boys. There's no way I'm going to prevent that to happen. So the only thing I would recommend is just decreasing the amount of time as much as possible. The texting part, the tablet stuff, you could probably stop. Maybe calling friends. I know, again, I don't know if they know how to use the phone. Use it and talk to people. Maybe that's what they could learn at that point. So that's a little easier. Okay. But yeah, the school part and not doing this, it's very hard. And trying to keep that limited down. And the thought is that should be resolved within 7 to 10 days. Okay. You might be able to do that, going back to school maybe a little bit. Depends on the school. Sometimes they'll let you come, back in for a couple of classes and just build them up that way. That's the hope. And then a graduated return to school or sports and work. So usually we'd start out with light aerobic exercises, keeping the heart rate less than 70%. No resistor training, so no strength training at all. Okay. And then sports-specific exercises, but no head impact kind of activities and drills. Okay. So you can do, like if it's lacrosse, you can toss balls to each other. You can do sort of side-to-side type movements. And then non-contact training drills. And you can start strength training at that point. And then full contact practice, as long as there's no bleeding or anything in the head, and then return to play. And each of these, as long as they're symptom-free, it's 24 hours. So if they can do the next level, they can start that in 24 hours as long as they're symptom-free. So they can keep doing that. Every 24 hours you can go up a level as long as you're symptom-free. If you develop symptoms, any of the symptoms that I talked about before, you drop them back down to that level until they're again symptom-free. Okay. And then you build it back up again. And then long-term effects. So if we didn't get to the patient, and sometimes we do, and they still develop post-concussive syndrome. We don't necessarily understand why some people do and why some don't. With the kids though, I kind of find they keep getting concussions, multiple of them. So sometimes it's not because they did it within the week, but they did it multiple times during the season and didn't bother to tell anybody. And so we find out later. So some of the post-concussive syndromes are the headaches, the nausea, the sensitivity to light and hearing, the vision changes, sleep disturbance, balance deficits. The emotional liability, irritability, depression, and anxiety also is part of this. Cognitively, slow processing, speech and attention deficits, impaired concentration, and then poor performance on the neuropsych testing. These are all post-concussive syndromes. And it's usually, we call it post-concussive about 3 months after the last injury. So it's just like chronic back or neck pain. That's when we call it post-concussive. Usually the treatments for these is much more difficult. A lot of times it's mostly what I see is more the pain, so the headaches, the neck pain kind of things. They're pretty difficult to treat with medications. I haven't found that they work all that well. So you're dealing with a chronic pain patient at that point in time. Having speech and neuropsych work with them to help with cognition or just to practice or adapt with whatever their deficits are is the other treatment that I also use, especially the neuropsych. They do have, so that family can work with them and use some of the adaptions behavioral that you find is difficult, especially with the younger kids too. And then PT and OT help with the balance and the adaptive type things. But again, it tends to be more speech and neuropsych that I'm using at that point, as well as just trying to control their pain somehow. And then usually the last thing for the post-concussive is some of these kids still are playing. So it's to tell the parent and the kids and the coach, you're done. And that's the hardest part, especially if this is something that they love to do, or this is where they excel and they haven't like in school and stuff. So what I'm leaving them is something that they're not too happy with, which is school or work. They'd rather be playing soccer and getting their head banged around or playing hockey. And that's the hardest part, is to tell them, no, you can't do this. Or you've got to find something else that won't hit your head with that. So that is the hardest. Then what we're finding now is all these degenerative diseases that are occurring, the Alzheimer's, Parkinson's. And CTE is actually diagnosed post-mortem. Okay? They have similar symptoms as Alzheimer's, but it's slowly progressive. So it's like over 18 to 20 years, and usually diagnosed at like 40, 50. But it's little things that happen with that, and it's just a slow kind of progressive. Both Alzheimer's and CTE, we've gotten a good way to treat it. So it's more of being aware. The medications that are around for Alzheimer's, Verisub, myself personally, I haven't seen that really work a whole heck of a lot with the patients. From the CTE, we don't have anything medication-wise to help with that. So it's a lot of therapy, it's a lot of training of family, of being aware of making their environment as safe as possible. Parkinson's, we have Cinnamon, but that's more if it ends up to being more in the physical type stuff. Again, the cognitive stuff is difficult to treat, so it's pretty hard. And then preventions. Again, with my kids, the helmets, they're, I was saying earlier, football players didn't used to have helmets because it was not the way to play. Then they use those other thingies, which I have no idea why they bother. Then we've got helmets now that do. They have the concussions. They do prevent it. What, especially in lacrosse and hockey, at least the sticks are somehow preventing their heads. Actually I was reading in the New York Times, because we were also talking about skiing. And what they were actually finding is the head injuries haven't decreased. The numbers have not decreased. And what they were looking at was the people's risk factor was increasing. So they were taking more risks. They were doing things that they would not normally have done if they didn't have a helmet. So my son's got a big lecture before we went skiing that, just because you have a helmet, you can't. So it's also something to be aware of is that they're young, they think they're invincible, now they got a helmet and they think they can hit anything. Rock doesn't move too much after it gets hit, neither does a tree. So those kind of things, we have to teach them that the helmet's not gonna, it's to help you remind, it's to help prevent certain injuries, but it's not gonna prevent the very traumatic. So it's more to teach them not to do those risky behaviors if we can. Also, we find that mark guards have seemed to help decrease some of the head injuries. And there's more from injuries that are coming from underneath, so that the jaw doesn't jam up into the upper gums and all that. And one of the bigger things that I actually think is decreasing the number of impact practices, especially in football. In football is the highest incidence of head injury in the boys. So they're finding that when they decrease those practices, they decrease the number of head injuries that they're having. And then changes in the rules of the game. In lacrosse, they are trying to decrease, anything that the stick comes anywhere near their head and their neck is a penalty. So there are changes that are occurring. Not everybody agrees with it, and you still see and hear lots of parents as well as coaches saying, get them, hit them, take them out. And so I'm one of these crazy mothers screaming at them, going, no, you moron, that's not how we play the game. So if you ever go to a lacrosse game, it has to be, one of the Ann Arbor schools. I might be there. Hearing that stuff. But that's one of the biggest things. If we could change the rules in some of the games still can be played. We could do it safer. And why wouldn't we do this? These are our kids. They're the ones that are going to end up being the doctors, the lawyers, the people who are going to have to take care of us. So we do want to make sure they can use their brains the way they're supposed to do it. So that's one. And then to be an advocate of return back to school and work and sports, to return slowly. Again, I'd rather take the time, I'd rather fight with the parent or the coach to deal with this because it's the kid in the long run or the patient in the long run who has to live with this, not them. So as much as the argument might occur because they think, Joe is going to be this awesome football player, is going to get a scholarship or go to college so they don't have to pay for it, that might not happen. So to change people's behavior is really important. That's the hardest part of it. And that's it.